showing the number of cases, deaths, and the positivity rate are increased, but the hospitalizations are decreased. They are under 200 cases in just the last day of the 24-hour period. Fewer than 3 people in Maryland are in the hospital. The positivity rate has increased by 1.56%. That VA.2 variant is driving new surges across China and Europe, and it's also in the United States as well. But doctors expected a new variant and say vaccinations are effective. Dr. Carrie Altoff of Johns Hopkins says we are in place where we can manage COVID as a new variant is in its early stages. Pfizer and Moderna have requested authorization for booster doses, and the Food and Drug Administration is set to meet in April. Hospitalizations in the state of Maryland have decreased to 94% from the all-time peak just 2 months ago and below 200 for the first time since last summer. Dr. Altoff says we should use this moment to catch our breath, and she is specifically referring to those who are either immunocompromised or unvaccinated. She says still need to remain cautious. Another under 200 confirmed cases were reported. There are fewer than 21 people in the hospital with the virus infections. Confirmed deaths are showing a decrease of 1. That number of deaths we have not seen a decrease since August of 2021. And the statewide positivity rate is decreased slightly to 1.43%. New testing data shows just how much of the pandemic is impacting your kids' learning. Tuesday, the Maryland Department State Board of Education shows 60% of Maryland's kindergartens are not demonstrating readiness to participate in school. State leaders pointed to the COVID-19 pandemic as part of the reason for the drop. Maryland students also saw an impact in math testing for grades 3 through 8. Their testing dropping from 33% to 15%. The readiness gap also increased between low-income families and children who were not from low-income families. Maryland leaders lay out the blueprint focused on spending billions of dollars to help increase kindergarten readiness and help underprivileged students, but there was some good news. More students did test proficiently in science, going from 34% in 2019 to 42% in 2021. State education officials noted that the tests were different in 2021 because of the pandemic and were abbreviated. Less than 250 new cases have been reported in the last 24 hours. The positivity percentage still dropping slightly to 1.45%. Two numbers we have for 8 each in hospitals and deaths. But however, there are 8 fewer people in the hospital and 8 more people have died. Moderna says that in the coming weeks, the company will ask the Food and Drug Administration to approve a vaccine for children under the age of 6 years old. Moderna hopes to get a green light to children 6 months to under 6 years old. A new lowest dose COVID-19 vaccine. Dr. Scott Krugman with Sinai Hospital, Baltimore says this is the only age group not eligible yet for a shot against COVID-19. Moderna reports enrolling about 700 kids under 6 in their study, which was done during the Omicron surge. The company says there are 2 doses using 25 micrograms of the vaccine in each shot. For perspective, Moderna says that's 25% of the first 2 doses adults get, and adds that group develop levels of the antibodies just as strong as young adults who get the full strength shot. There are 7 children in Maryland hospitalized, including 5 in intensive care unit. And with the new variant already making its way into the states, both Pfizer and Moderna have been asking the Food and Drug Administration to approve a 4th dose, essentially a second booster shot, as the effectiveness of the shot begins to wear off. The COVID-19 numbers have definitely all increased in the past 24 hours. There is a new research that supports shorter quarantines for healthcare workers exposed to COVID. A new study in the American Journal of Infectious Control shows workers can safely go back to work after 7 days if they don't have symptoms and test negative. The study looked at unvaccinated healthcare workers from January to June of last year. Less than 400 new cases have been reported in the last day. 2 fewer people are hospitalized, and the statewide positivity rate is showing the same percentage since Wednesday, is 1.45%. Of course, the positive test rate is back decrease. Aspirin may help preventing death from COVID-19. A study at George Washington University found patients hospitalized with moderate infections had a lowest risk of dying if they were given aspirin early in their treatment. Researchers say the finding is especially important in parts of the world where more expensive treatments are not an option. And finally, a study of patients with long COVID finds different variants may lead to a different symptoms. Researchers in Italy found once the alpha variant became a dominant strain, patients were more likely to suffer persistent muscle aches, insomnia, and brain fog. The loss of smell associated with the original COVID strain became less common, as well as difficulty swallowing and impaired hearing. "400 new cases were reported. Less than 20 people are being treated in the hospitals. 6 more Marylanders have died from COVID, and the positivity rate percentage is back up to 1.47%. We definitely don't want the positivity rate to increase. 4,741,530 have got their first dose. 4,186,000 got their second dose. 336,331 got their single dose. 2,237,000 people in the state of Maryland have gotten their booster dose shot. Total for administered dose, nearly 11,502,000. 15,285,000 are distributed with the dose. And finally, 4,522,000 people are already been fully vaccinated. For those of you in Maryland who are new at this, if you want to look at the COVID-19 data chart and vaccination data, log on to their Maryland's link at coronavirus.maryland.gov.